Hi everyone, this is Dr. Mamta Jawa, your microbiology faculty. In this very episode of the Residency Explorer series, I'm going to talk about residency in medical or clinical microbiology. So, guys, microbiology, you all know, is the study of organisms of microscopic size, that is, those organisms which we cannot see with naked eye. For seeing these organisms, we need the help or the aid of a microscope. Now, microbiology has got a lot of domains like agricultural microbiology, industrial microbiology, marine microbiology, but we being medicos are going to be interested in medical or clinical microbiology, which deals with the study of those microorganisms which are medically or clinically significant or relevant. That is, those microorganisms which can infect human beings, and the outcome of these infections could be anything from asymptomatic to mild disease to severe disease to severely fatal disease, depending on a lot of factors pertaining to the microorganism in question and our immune response towards that microbe. All right. And literally, we are immersed in a sea of microorganisms inhabiting this Mother Earth. So, the number of microorganisms which is there on the Mother Earth is much, much more than human population. So, on a daily basis, guys, we are eating microbes, inhaling microbes, touching microbes, but do we fall sick often? No, we don't. Now, the reason is because most of the microorganisms are not bad, most are innocent. They are either saprophytes in the environment, all right, or many microorganisms are actually our friends, which we call as commensals, which you all know. They are living on our skin or inside our body, lining our mucosal membranes. For example, the upper respiratory tract, the gastrointestinal tract, the genitourinary tract. All right, so these commensal microorganisms are the friendly microorganisms. They are a blessing for us because they are going to act as competitors for the potential pathogenic microorganisms trying to invade our body and trying to trouble us. So that is one reason. The other is significant. The other important reason behind we not falling sick often is a fantastically beautifully crafted immune system by the Almighty, which has got an amalgamation of proteins like antibodies, complement proteins, and a lot of cells like macrophages, neutrophils, the helper T cells, the cytotoxic T cells, the B cells, and so on and so forth. And all of these cells and proteins do a fantastic teamwork in springing up in action when we get infected. So these are the two important reasons behind us not falling sick often. And that is why I broadly categorize my subject into two: the study of the medically significant microorganisms, which is extremely important because, as they say, know your enemy well, so that once you decipher or decode the strengths and weaknesses of your enemies, you can speculate their next move and you can do something to safeguard you against the potential damage or manipulation or toxicity, whatever you want to call it, because of your enemy. So as far as our pathogenic microorganisms or medically significant microorganisms are concerned, it's very, very important to know their structure, the pathogenesis of the infectious disease they cause, so that based on all this information we can devise appropriate diagnostic tests. And based on these diagnostic tests, we can come to a conclusion that okay, this antibiotic is going to work in this very infectious disease, and this knowledge also helps us in devising appropriate vaccines, and of course antibiotics also. So all that information is extremely vital. And the other thing which I discuss in my subject is the strength which God the Almighty has given us, that is the immune system, because it's important to know about our own strengths also, and not just the strength of our enemy. So our strength is a beautifully crafted immune system which does a fantastic teamwork, as I said. And there's number one, there's nobody, no cell, no protein in the immune system is said to be the number one or numero uno, because immunology, when we read about it, many things are going to happen simultaneously in the human body after we get infected. And trust you me, it's just beautiful to see how how on a microscopic level we are being protected against the disease development following infection, thanks to our immune system, that is the immune response. So that is the other thing which my specialty deals with. So, guys, in any microbiology lab the world over, a very basic investigation is done is the microscopic examination on a plethora of clinical specimens which we receive, which could be a urine sample, feces sample, sputum sample, body fluids like CSF, pleural fluid, etc., etc. Now, in microscopic examination, also a lot of things we can do. Like, for example, hanging drop preparation is done to ascertain whether an organism is motile or not. If we are suspecting tuberculosis in any patient who has, let's say, come to us with a history of who has presented to the clinician with a history of let's say 1 month history of weight loss, night sweats, productive cough, the sputum is blood tinged, foul smelling. All right. So, in a country like India, which is the world capital of TB, in such a patient, the first thing to do is rule out infection by Mycobacterium tuberculosis, which most commonly causes pulmonary tuberculosis. All right. And if that has to be ruled out, what microscopic examination is to be done on the sputum sample of such a patient? It is the acid fast stain or the Zeal Nielsen stain. So this is just one example I gave you of the microscopic investigation which we do. So based on the signs and symptoms the patient has presented with to the clinician, and also the epidemiology of the area in which the patient is living, the occupation of the patient, the clinician discusses with us about all the investigations which are to be done to rule out or rule in an infectious disease. So microscopic examination extremely important. Then, guys, we have got, of course, what is known as culture or isolation of microorganisms. This particular meme, support bacteria, that's the only culture some people have. This still is a very famous meme on the internet. All right. So basically, that's the fun part of it, just the joke. Basically, when we talk about culture or isolating the organisms from clinical specimens, we are actually providing a kind of bribe to the organisms which could be present in the clinical specimens. And when I say bribe, I refer to culture media. A very good analogy to understand culture media is the bribe, which is nothing but the nutrients present in the culture media, so that if any organism is present in the clinical specimen, that will grow, and that growth is going to be visible in the form of colonies like these. Now these colonies subsequently are going to be subjected to a plethora of biochemical reactions, which is done in the conventional diagnostic microbiology, which luckily has been replaced by automated methods of detection of microorganisms in a lot of state of the art labs. Automation has played a very, very important role in cutting down the time which we need in giving the accurate report to the patient. So remember, two very, very basic investigations which are done in any microbiology lab the world over are the microscopic examination of the clinical specimens, which could include the examination of simple wet mounts or staining techniques like gram stain, AFB stain, etc., etc., and of course culture. Now the choice of the culture media is usually decided based on the kind of organism we are suspecting, but in general we use the routine culture media like McConkey agar, blood agar, chocolate agar. If let's say we are suspecting a very unique kind of microorganism which we know will not grow on these media, let's say Legionella pneumophila, then the choice of medium will be buffered charcoal yeast extract agar, which we know will allow Legionella organisms to grow. So sometimes we have to make a decision regarding some special or unique kind of culture media depending on our suspicion about some different kind of organism in the clinical specimen of the patient, which we know will not grow on routine media. All right. So guys, apart from culture or isolation and microscopic examination, another important domain in residency which you will be exposed to is the serological techniques. Now, serum means serum, logos means to study. So basically, we study the serum sample of the patient. And what are we studying the sample for? We are studying the serum sample of the patient for the presence of either antibodies or the antigens. And whatever we are seeking to find in the serum specimen, the opposite of it is supposed to be added. If we want to detect the antigen in the sample, we have to add the antibodies and vice versa. And these kind of tests are subjected to a lot of other samples also, like for example CSF sample, for instance in case of rabies, H influenza infection. So we have got a plethora of serological techniques, like we have got ELISA and rapid tests, and this has revolutionized the diagnostic microbiology in a great way. Now, serology is also important because the importance of seroconversion after vaccination or after infection cannot be overemphasized. All right. So, antibodies, of course, are going to play a very, very important role in putting up a good defense mechanism against most of the microorganisms. All right. And these antibodies are expected to appear obviously after natural infection in most of the cases, and also after vaccination. And the best example perhaps I can give you about the importance of seroconversion is the horrific pandemic which we all had to go through, that is the COVID-19 pandemic. All right, now seroconversion becomes so very important after vaccination and also a lot of natural infections. Then of course we have got molecular techniques like PCR, ligase chain reaction, etc. Now, the gold standard diagnostic method for many infections has been culture for many, many years, but that has seen a drastic change with the coming up of these molecular techniques, which, by the way, are extremely sensitive and specific, and that is why they are becoming the gold standard diagnostic test for a lot of infectious diseases. The classical example being chlamydial infections, infections caused by chlamydia trachomatis. All right, the only disadvantage of these molecular techniques is their cost. They are extremely costly. Now, guys, on your screens, you are seeing the covers of important textbooks and reference books of clinical or medical microbiology. I have used all these resources, and I still, read these books. And my most favorite book is Warren Levinson, which I would suggest should be read from, word by word. It's a beautifully written book in a very simple language, has got fantastic questions. Usually it is read by USMLE aspirants, but of course postgraduates of microbiology and even undergraduates should read this book, which is written so beautifully and very, very simply. Then for postgraduates exclusively, we have got this another brilliant book, namely Bailey and Scott's Diagnostic Microbiology. What I personally liked most about this book is the system wise coverage of clinical microbiology, which I don't think any other book gives does justice to as much as this book has done. Then you will hear a lot about this book, Kohnman's Diagnostic Microbiology. I personally did not like it that much during my residency. I personally feel that Kohnman should be used primarily for the biochemical reactions. That's all. Okay, because the other things you will cover from all of these other sources. Then another favorite of mine is this book by Murray, and there's a small pocket book of Murray also, which is very good to read about, which is very good for culture media. Now this cover which you are seeing right now on the screen is of the Badi Wali textbook of Murray, and this of course the postgraduates should read word by word. Like it is not a reference book, it should be used as a textbook. And then we have got the mother of all textbooks on clinical microbiology, Topley and Wilson. It's a 10-volume book, but of course it's a reference book. It is not to be read fully. Nobody can read it fully, just like you can't read Harrison's fully. So basically Topley and Wilson's is R. Harrison for medical or clinical microbiology. Now there are some topics which are beautifully given in Topley and Wilson's and should be read from this book only. Like for example, Enterobacteriaceae, many topics of general microbiology like virulence factors. Virology is so in this book. And talking about virology, one cover which is not there in this slide is that of Javit's textbook of medical microbiology, which is very good for virology. All right, now guys, I have a soft corner for immunology. It is my most favorite domain in my specialty, in my subject. And if you want to have solid concepts on immunology, then the go-to book is Kubi Immunology. It is a beautiful book with beautiful illustrations, with a lot of historical insights also in immunology. So I would suggest, please don't miss out on this book. Usually Riot's is more famous for immunology. You often hear you would hear your seniors talking about Riot's, which by the way is a very very good book. But I think you will understand Riot's much better after you have read Kubi's immunology. Now, Kubi is a very very doable book for postgraduates, as in, it can be read from, by word. But Riot's, I would say, should be used as a reference book only. Okay. So that's about the textbooks. Now, I hope this video helps you, and if you have any kind of doubts, you can mention in the comment section, or you can even DM me on Instagram. Thank you.